This video is for wrapping packs, and this is specifically for the GI pack, though it can go with most other packs, though you probably won't be putting lap sponges or other items in. But this is a basic pack wrapping. So one of the first things you want to do is take all your towel clamps and put them with an Alice together. You go through the handles and then latch the last handle with the Alice so that when you would put it downward, it does not fall out. And then lay that on your tray. And on your tray, you should have a terry cloth, a huck towel. That way the items, the instruments do not slide around as much when you put them on. Your second one will have the rest of your instruments, your hemostats, and scissors. And I would put the scissor at the very end because you will be using that first to cut your drape. So once those are put in and laid on your tray on top of the towel, take your bowl and fill it with gauze. Put your bowl down. Take 2 laparotomy sponges, which is also known as lap sponges. You will also need 4 huck towels, and these are the towels that are not terry cloth. They are smaller than the terry cloth towels, and you use those as part of your drape, as the first part of your drape, and you will put those on your tray. And then you will take your big drape and put that on as well. And after that, you will take your indicator strip and put that in your pack. The terry cloth towels that are underneath will be in a T type fashion, and you put your tray in the middle of that T. You will then drape your towels over and close it up, wrap it up. It's just another way to keep your tray clean and to have other areas, sterile areas, to put your instruments when you need it. This is similar to the gown wrapping. When you wrap your pack, you will have 2 drapes, 2 wraps, sorry, not drapes. And you will put your tray in the middle of it at an angle so that you will pull up the one end. And some of these drapes are going to be really big, but you should be able to fold them again in an accordion fashion with your tab out and down. You will then go to the sides. The double draping is so that you can open it up, or somebody can open up before the surgeon can open it. And so you can drop some items on a sterile area. And the surgeons can then, once they are sterilely gloved, can grab those items, i.e. suture and other blades and things like that that will want to remain sterile, but this makes it easier for the techs and everybody else to do that, to do the dropping off while they're getting other things ready. Again, now I'm not turning it around, but usually I would turn it around. Actually, I am going to so you can see. I gathered it all up together, going between and tucking, not rolling. Again, it's sticking out, and I do it with the other drape as well. Sorry, just checking what my drape is like. This is a huge drape, but we will make it work. Again, pulling tight. Having it tight makes all the difference in the world. You don't have to rip it, but tight is good. And as you can see, that's not necessarily even, but it should still work because you will accordion fold. And then I will flip it around again. And take all that extra and tuck. And by holding it, it will stay. This we will not throw. And then you would tape it, two things here, label what it is, the date, and your name.